Hello and welcome to another episode of Health Talk 366, your trusted destination for evidence-based insights on health, wellness, and everything in between. I'm your host, and I'm so glad you're here with me today. Today, we're going deep into a topic that affects millions around the globe, and yet, so many people still don't understand the dangerous connection between diabetes and heart health. This episode is titled, Diabetes and Heart Health, How Diabetes Affects the Heart. And trust me, even if you don't have diabetes, or don't think you're at risk, this is information that could one day save your life, or the life of someone you love. Let's take a moment to reflect on just how widespread diabetes really is. As of now, over 530 million people worldwide are living with diabetes. That's more than the entire population of the United States, Canada, and Mexico combined. But here's what many people don't realize. If you have diabetes, especially type 2 diabetes, your risk of heart disease is not just slightly higher. It's 2 to 4 times higher than someone without diabetes. That's huge. In fact, heart disease is the leading cause of death among people with diabetes. Not kidney failure, not vision loss, heart disease. And yet, many people with diabetes aren't even aware of this link. They're managing their blood sugar day to day, but no one's told them that the same disease process affecting their pancreas is slowly, silently damaging their heart and blood vessels. That's why this episode matters. You'll learn what diabetes really is, how it damages your arteries, what warning signs to watch out for, which tests your doctor should be running, and what actions you can take today to protect your heart and your life. Whether you've been living with diabetes for years or just want to understand it better, you're in the right place. We're going to start with the basics and go deep. So grab a glass of water, or go for a walk while you listen, or just sit back and relax. This is going to be a long, insightful ride. Let's begin. Now, let's lay the foundation by understanding what diabetes really is, because you can't understand how it affects the heart until you understand what it's doing to your body overall. Most people think of diabetes as a condition where your blood sugar is too high. And yes, that's true, but it's just the surface. Diabetes is not just about sugar. It's a metabolic disorder that affects how your body uses energy. When you eat, your body breaks down carbohydrates into glucose, a type of sugar that your cells use for fuel. But glucose can't get into your cells on its own. It needs help. That help comes from a hormone called insulin, produced by your pancreas. Think of insulin as a key that unlocks the door to your cells, letting glucose in. If there's no insulin, or if your body becomes resistant to it, glucose builds up in your blood instead of going where it needs to go. There are a few types of diabetes. Type 1 diabetes is when your immune system destroys insulin-producing cells. You make little or no insulin. Type 2 diabetes, the most common, is when your body becomes resistant to insulin. Your pancreas still makes insulin, but your cells don't respond to it properly. Gestational diabetes happens during pregnancy and usually goes away after delivery. Prediabetes is when blood sugar is elevated but not high enough to be diagnosed as diabetes, yet it still increases your risk of heart disease. And here's something crucial. Insulin resistance, the hallmark of type 2 and prediabetes, often begins years before diabetes is diagnosed. During that time, silent damage is already happening inside your arteries. Insulin resistance isn't just a sugar problem. It's also a blood pressure problem, a cholesterol problem, an inflammation problem, and a fat storage problem, all of which increase your risk of heart disease. So what's going on beneath the surface? Let's talk about what high blood sugar and high insulin levels do to your body over time. First, your blood vessels take a hit. High glucose levels lead to the production of toxic molecules called advanced glycation end products, or AGEs, which damage blood vessel walls. This damage triggers inflammation and reduces elasticity in the arteries, making them stiff and prone to buildup. Meanwhile, your immune system begins treating your blood vessels like they're under attack. White blood cells rush in, inflammation takes hold, and cholesterol begins to stick to the damaged areas. That's the beginning of atherosclerosis, the process of plaque buildup that leads to heart attacks and strokes. And if you add high blood pressure, which is common in people with diabetes, you're increasing the pressure on those fragile, inflamed vessels. Over time, your arteries narrow, your heart works harder, and your risk of serious cardiovascular events skyrockets. To make matters worse, Diabetes often damages the tiny blood vessels, not just the big ones. That's why people with diabetes can lose vision, retinopathy, kidney function, nephropathy, and sensation in their feet, neuropathy. But those same microvessels supply your heart muscle too, which means the heart can suffer from something called diabetic cardiomyopathy, where the heart muscle becomes stiff and weak even without blocked arteries. You may not feel it happening. That's the scary part. Diabetes can damage the nerves that signal pain. This is why many diabetics experience silent heart attacks with no chest pain, no warning signs. All of this may sound overwhelming, but remember, knowledge is power. And now that you understand the mechanisms, we can move toward identifying symptoms, diagnosing problems early, and most importantly, preventing damage before it starts. Let's keep going. Now let's explore exactly how diabetes damages the heart, not just hypothetically, not just statistically, but biologically, chemically, and physically. If you've ever wondered how high blood sugar translates into heart attacks, strokes, and clogged arteries, this is the part you've been waiting for. Let's break it down. First, let's talk about the endothelium, the delicate inner lining of your blood vessels. In a healthy person, this lining helps blood flow smoothly and keeps arteries flexible. But in people with diabetes, high blood sugar and high insulin levels cause damage to this layer. The result is something called endothelial dysfunction. You lose that smooth Teflon-like surface, and instead you get a sticky, inflamed inner lining where cholesterol and inflammatory cells begin to stick. This is the first step toward atherosclerosis, the hardening and narrowing of arteries. On top of that, insulin resistance prevents the blood vessels from expanding properly. Normally, insulin helps blood vessels relax and dilate. But in insulin resistance, this process is impaired. That leads to higher blood pressure, more strain on the heart, and less oxygen delivery to the tissues. Next, we have inflammation. High blood sugar triggers an immune response. Your white blood cells act like something's wrong, even though there's no infection, and they begin damaging the vessel walls even more. Over time, cholesterol builds up, calcifies, and forms plaques. But it gets worse. These plaques in diabetics tend to be more unstable. That means they're more likely to rupture, and when that happens, a clot can form and completely block blood flow, causing a heart attack or stroke. Another piece of the puzzle is something called advanced glycation end products, or AGEs. When sugar attaches to proteins in your blood, it changes their shape and function. These AGEs stiffen your arteries and promote even more inflammation. It's like adding glue to your bloodstream. Everything becomes stickier, stiffer, and more inflammatory. And it's not just the big arteries that are affected. Diabetes also damages the microvasculature, the tiny blood vessels that supply your nerves, eyes, kidneys, and yes, your heart muscle itself. That means that even without a big blocked artery, your heart can suffer from a lack of oxygen. This leads to a condition called diabetic cardiomyopathy, where the heart muscle becomes weak and stiff. As this damage accumulates, the heart begins to struggle. At first, you may feel nothing. Then maybe you feel fatigue when climbing stairs. Maybe you start to notice swelling in your ankles or shortness of breath. Eventually, the heart can no longer keep up, and that's when heart failure begins. But here's something even more dangerous. Because diabetes can also damage the nerves, many people don't feel the typical warning signs. You've heard of silent heart attacks. That's a real thing, and it's more common in diabetics because of diabetic neuropathy. To make matters more complex, diabetes also disrupts your cholesterol levels. It increases LDL, bad cholesterol, especially small dense particles that are more likely to cause damage. It lowers HDL, good cholesterol. It raises triglycerides, fats in the blood that promote heart disease. Combine that with high blood pressure, insulin resistance, inflammation, and endothelial dysfunction, and you've got a perfect storm. This is why diabetes isn't just a sugar problem. It's a vascular disease, a heart disease, and a metabolic time bomb that, if ignored, can shorten your life dramatically. But remember, knowledge is power. And now that you understand exactly how diabetes damages the heart, you're better prepared to recognize the signs, make lifestyle changes, and take action before the damage becomes irreversible. Next, we'll talk about the specific heart conditions that tend to show up in people with diabetes. Not just how they form, but what they feel like, how they're diagnosed, and what you can do to manage or prevent them. Keep listening. We're just getting started. So let's talk about the specific heart conditions that tend to show up in people with diabetes. First up, coronary artery disease, or CAD. This is the most common type of heart disease in the general population, and it's even more common in people with diabetes. Coronary artery disease happens when plaque builds up inside the arteries that supply blood to your heart muscle. These arteries become narrowed or blocked, reducing the flow of oxygen to the heart. The symptoms. They might include chest pain or discomfort, especially during physical activity, shortness of breath, fatigue, pain in the arms, back, neck, jaw, or stomach. But remember what we said earlier. Diabetics may have silent ischemia. That means they may have blockages without feeling any pain. That's why routine screening and monitoring are so important, even if you feel fine. Next, heart failure. Heart failure doesn't mean your heart has stopped. It means your heart can't pump enough blood to meet your body's needs. In diabetics, heart failure can be caused by long-term high blood pressure, coronary artery disease, diabetic cardiomyopathy, damage to the heart muscle from high blood sugar. The signs of heart failure include shortness of breath, especially when lying flat, swelling in the legs, ankles, or abdomen, rapid weight gain from fluid retention, fatigue and weakness. Another issue is arrhythmias, or irregular heart rhythms. Diabetes can disrupt the electrical system of the heart, especially if there's nerve damage involved. Some arrhythmias are harmless. Others, like atrial fibrillation, can increase your risk of stroke. Symptoms may include palpitations, dizziness or fainting, chest discomfort. Then there's peripheral artery disease, PAD. This affects the arteries that carry blood to the legs and feet. People with PAD may feel leg pain when walking, claudication, cold feet, poor wound healing, increased risk of foot ulcers and infections. PAD is a sign that atherosclerosis isn't just affecting the heart, it's happening throughout the body. Lastly, we can't forget stroke. Diabetes increases the risk of stroke by affecting both large and small blood vessels in the brain. Add in high blood pressure, abnormal cholesterol, and a tendency to form blood clots, and you have a dangerous combination. Stroke symptoms include sudden numbness or weakness in the face, arm or leg, confusion or difficulty speaking, trouble seeing, loss of balance, sudden, severe headache. Remember, time is brain. If you suspect a stroke, call emergency services immediately. To sum it up, diabetes is linked to all the major types of cardiovascular disease, coronary artery disease, heart failure, arrhythmias, peripheral artery disease, stroke. Understanding the risks is the first step toward taking action. But what about prevention and monitoring? That's what we'll cover next. Let's dive into how we monitor and detect these problems early, because early detection can make all the difference. There are several tools that doctors use to monitor your heart health if you have diabetes. And if your doctor isn't using them, it might be time to ask. Let's start with the basics. 1. The electrocardiogram, ECG or EKG. This test records the electrical signals in your heart. It's quick, painless, and can detect irregular heart rhythms, previous silent heart attacks, signs of thickened heart muscle. Even if you feel fine, a baseline ECG can help identify early warning signs. 2. Echocardiogram. Echo. This is an ultrasound of the heart. It shows how well your heart is pumping, if your heart walls are thickened, if there's fluid around the heart, valve problems. In diabetics, it can catch early signs of diabetic cardiomyopathy before symptoms start. 3. Stress testing. This involves walking on a treadmill or getting medication that simulates exercise while your heart is monitored. It can reveal blood flow issues, hidden coronary artery disease, abnormal rhythms under stress. 4. Coronary calcium scoring, CT calcium scan. This is a non-invasive CT scan that looks for calcium deposits in your coronary arteries, an early sign of plaque buildup. A higher score means a higher risk. 5. Ankle brachial index, ABI. This simple test compares the blood pressure in your ankle to your arm. It can detect peripheral artery disease. Now let's talk about blood tests. A1C shows your average blood sugar over 2 to 3 months, fasting glucose, snapshot of current blood sugar, insulin levels and home IR. Help detect insulin resistance before diabetes is diagnosed, cholesterol panel, including LDL, HDL, and triglycerides, CRP, C-reactive protein, a marker of inflammation, and T-proBNP or BNP, used to detect heart failure. Many people only get the basic A1C and glucose, but in reality, insulin levels and inflammatory markers give a much fuller picture. Wearable tech is also changing the game. Smartwatches can track heart rate variability and detect arrhythmias like atrial fibrillation. Continuous glucose monitors, CGMs, provide real-time feedback on blood sugar trends, which is invaluable for understanding how food, stress, and sleep affect your body. Regular monitoring doesn't just help your doctor, it empowers you to take action early. It's not about fear, it's about awareness. In the next section, we'll talk about how to take control, what to eat, how to move, and what daily habits can protect your heart for decades to come. Let's keep going. Let's talk about prevention, because while diabetes increases your risk of heart disease, it's not a guarantee. You have more power than you think. The good news? Many of the same lifestyle choices that help manage diabetes also protect your heart. Let's walk through the most important ones. 1. Nutrition. Eat to support both blood sugar and heart health. You don't need to follow a fad diet. What you need is a sustainable, nutrient-rich approach to eating. Great options include the Mediterranean diet, full of fruits, vegetables, whole grains, nuts, fish, and olive oil, low glycemic index foods, like lentils, steel-cut oats, quinoa, and non-starchy vegetables, anti-inflammatory foods, such as berries, leafy greens, turmeric, and fatty fish like salmon. Limit or avoid added sugars and sweetened drinks, trans fats and highly processed snacks, excess sodium, large portions of refined carbs, white bread, white rice, pastries. It's not just about what you cut out, it's about what you add in. Prioritize fiber, healthy fats, and plant-based antioxidants. 2. Exercise. Move every day. It's medicine. Physical activity improves insulin sensitivity, lowers blood pressure, strengthens your heart, and helps manage weight. You don't need a gym membership. Just aim for 30 minutes of brisk walking most days of the week, or cycling, swimming, yoga, dancing, anything that gets your heart rate up. Add resistance training 2 to 3 times per week to build muscle and improve glucose uptake. Even 10-minute walks after meals can significantly lower your blood sugar. 3. Sleep. Restore and repair. Poor sleep increases insulin resistance, blood pressure, and appetite. Aim for 7 to 9 hours of quality sleep per night. Create a routine. Go to bed and wake up at the same time daily. Avoid screens an hour before bed. Keep your room cool, dark, and quiet. 4. Stress management. Protect your heart and mind. Chronic stress raises cortisol, which increases blood sugar and blood pressure. Find what helps you decompress. Meditation or mindfulness, deep breathing exercises, journaling, time in nature, laughing, music, or hobbies you love. Don't underestimate the power of mental well-being and physical health. 5. Quit smoking. No exception. Smoking plus diabetes is a deadly combo. It accelerates atherosclerosis, weakens blood vessels, and drastically increases the risk of heart attack and stroke. Quitting isn't easy, but it's worth it. There are medications, apps, counseling, and support groups to help you succeed. 6. Alcohol. Limit or avoid alcohol can raise triglycerides and blood sugar, interfere with medications, and promote weight gain. If you drink, do so in moderation. Up to 1 drink per day for women, up to 2 for men. 7. Medication adherence and routine checkups. Lifestyle is powerful, but sometimes medication is necessary too. Take your medications exactly as prescribed. Don't skip doses. And don't wait for symptoms. Keep up with checkups, labs, and screenings. In the next section, we'll talk about medications in more detail, which ones protect the heart, and how to work with your doctor to build the right regimen for your situation. Stay with me, we're almost there. Let's now explore the role of medical management and medications in protecting your heart when you have diabetes. Lifestyle changes are powerful, but medications can play an essential role, especially when risks are high or damage has already begun. Here's a breakdown of the most important medications and classes that can benefit both your blood sugar and your heart. 1. SGLT2 inhibitors, like empagliflozin, dapagliflozin. These drugs help your kidneys remove excess glucose through urine. But that's not all. They've been shown to reduce the risk of heart failure, lower the risk of hospitalization due to heart problems, protect kidney function. For people with diabetes and established heart disease or kidney disease, SGLT2 inhibitors are often a first-line choice. 2. GLP-1 receptor agonists, like liraglutide, semaglutide. These mimic a natural hormone that helps lower blood sugar after meals. Benefits include weight loss, reduced appetite, cardiovascular protection. Some GLP-1 medications have been proven to reduce the risk of heart attacks and strokes. 3. Metformin, still considered the foundational medication for type 2 diabetes. It improves insulin sensitivity and may offer modest cardiovascular benefits, especially in newly diagnosed patients. 4. Statins, cholesterol-lowering drugs. These don't just lower LDL, they stabilize plaques, reduce inflammation, and reduce the risk of heart attacks and strokes. Even if your cholesterol looks okay, your doctor may recommend a statin if you have diabetes because the risk is so high. 5. Blood pressure medications. Controlling blood pressure is essential. Common classes include ACE inhibitors and ARBs, also protect kidney function, calcium channel blockers, thiazide diuretics. Target blood pressure is usually below 130/80 mmHg in diabetics, but this can vary based on your overall health. 6. Antiplatelet therapy. Aspirin may be recommended if you have existing heart disease or very high risk. It helps prevent clot formation that could lead to heart attack or stroke. However, it's not for everyone because it can increase bleeding risk. Your doctor will weigh the pros and cons. 7. Insulin and non-insulin options. For some people, especially those with long-standing diabetes or high A1C, insulin is necessary. But newer non-insulin medications can also help manage blood sugar with fewer side effects. The key takeaway is this: medication plans should be personalized. What works for one person may not work for another. Work closely with your healthcare team. Ask about heart protective diabetes medications. Don't just focus on blood sugar, focus on your heart. Coming up next, how your mental and emotional health plays a surprisingly large role in both diabetes and heart outcomes. Let's keep going. You may not think stress, anxiety, or depression have anything to do with your heart or blood sugar, but they absolutely do. Let's start with stress. When you're stressed, your body releases a hormone called cortisol. In the short term, cortisol helps you respond to danger. But chronic stress, the kind that lingers day after day, keeps cortisol levels high. High cortisol does several things: raises blood sugar, increases insulin resistance, elevates blood pressure, triggers inflammation, promotes fat storage, especially around the belly. In other words, chronic stress mimics and worsens the effects of diabetes. Now add in depression, which is common in people with diabetes. Studies show that people with depression are less likely to take medications, follow dietary recommendations, or exercise regularly. Depression is also linked to higher levels of inflammation and increased risk of cardiovascular events. On the flip side, diabetes itself can contribute to depression, forming a vicious cycle. You feel overwhelmed, exhausted, and frustrated. And those feelings impact your choices, your hormones, and your health. So what can you do? 1. Prioritize mental health as part of your treatment plan. Your emotional well-being is just as important as your lab results. Talk to your doctor or a mental health professional if you're struggling. 2. Build a support system. That might include friends, family, a therapist, a support group, or even an online community of others living with diabetes. Social connection reduces stress and promotes accountability. 3. Try mind-body practices. Techniques like meditation, yoga, tai chi, and deep breathing can reduce cortisol, improve mood, and even enhance insulin sensitivity. 4. Set realistic goals. Managing a chronic condition isn't about perfection. It's about consistency, forgiveness, and progress over time. 5. Celebrate small wins. Every healthy choice you make, every step, every meal, every moment of rest, is an act of self-care that adds up. Your brain and your body are deeply connected. Supporting your mental health isn't just good for your mind, it's good for your heart. Coming up next, real stories and case examples that bring all of this to life. Stay tuned. Let's now bring this all together with some real-life stories and fictionalized case studies that reflect common scenarios. These will help you see what diabetes and heart disease look like in everyday life, and how knowledge, prevention, and timely care can change the outcome. Case Study 1. The Miss Science Michael is a 52-year-old man who works long hours at a desk job. He's had type 2 diabetes for about 8 years, but he doesn't take it too seriously. He checks his blood sugar occasionally, eats what he wants, and takes his metformin when he remembers. One afternoon, Michael feels a strange tightness in his chest. Not pain, exactly, just discomfort. He brushes it off as indigestion. A few days later, it happens again, this time with fatigue and sweating. He ends up in the emergency room with a heart attack. The doctors discover he's had several episodes of silent ischemia, where blood flow to the heart was reduced without obvious symptoms. The lesson here: don't ignore your symptoms. And don't rely on pain as the only warning sign, especially if you have diabetes. Case Study 2. The preventative path. Anna is 45 and recently diagnosed with prediabetes. Her A1C is 6%. Her doctor talks to her about the risks, not just of diabetes, but of heart disease. Anna decides to take control. She changes her diet, starts walking 30 minutes a day, and loses 15 pounds over 6 months. Her A1C drops to 5.6%, her blood pressure improves, and she feels better than she has in years. She never needed medication, just awareness, commitment, and support, and she likely prevented a cascade of future health problems. Case Study 3. Complications managed proactively. Carlos is 60 and has had diabetes for 12 years. He's also got high blood pressure and high cholesterol. But Carlos works closely with his doctor. He's on a GLP-1 receptor agonist and a statin. He uses a continuous glucose monitor and tracks his steps daily. At his annual exam, his doctor notices a slight change in his ECG and orders a stress test. It reveals a blockage, caught early. He gets a stent placed and avoids a heart attack. This is what proactive, informed care looks like. Every story is different, but the themes are the same. Awareness matters, prevention is powerful, partnership with your care team saves lives. We'll wrap up this episode with one final section, a recap, a plan, and what you can start doing today to protect your heart and take charge of your diabetes. Let's finish strong. Let's recap what we've learned today and walk away with a clear, empowering plan of action. First, we learned that diabetes is not just about sugar, it's a complex, systemic condition that affects every part of the body, especially the heart. It damages blood vessels, nerves, and vital organs silently and progressively. Second, we uncovered how high blood sugar, insulin resistance, and inflammation directly contribute to endothelial dysfunction, plaque buildup and atherosclerosis, increased blood pressure, increased clotting risk, and weakened heart muscle function. Third, we talked about the specific types of cardiovascular issues common in people with diabetes: coronary artery disease, heart failure, stroke, peripheral artery disease, arrhythmias. Fourth, we discussed how to detect these risks early with tools like ECGs, echocardiograms, calcium scoring, ABI, lab tests, and even wearable tech. Fifth, we emphasized the role of prevention through food, movement, rest, stress reduction, and eliminating harmful habits like smoking. Sixth, we explored the modern medications that do more than just lower blood sugar, they actively reduce cardiovascular risk and save lives. Seventh, we recognized how mental health, stress, and emotional well-being shape your habits, your hormones, and ultimately your outcomes. And finally, we heard from relatable, real-world stories of people just like you, facing diabetes, learning, adapting, and making changes that had a lasting impact. So where do you start? Here's your action plan. 1. Know your numbers. A1C, blood pressure, LDL, fasting insulin, and inflammatory markers. 2. Schedule a heart checkup, even if you feel fine. 3. Move daily. Walk, dance, stretch, lift, play. Just move. 4. Eat with purpose. Choose foods that love you back. 5. Manage stress, one deep breath at a time. 6. Take your meds if prescribed, and talk to your doctor about the best options. 7. Get support. No one should face diabetes alone. And most of all, believe that change is possible. Diabetes may raise your risks, But with awareness, consistency, and support, you can lower those risks. You can live fully. You can protect your heart, your energy, your mobility, and your future. Thank you for joining me on this journey through one of the most important conversations we can have in modern healthcare. This has been Health Talk 366. If this episode helped you, please share it with someone who needs it. You might change or even save a life. Until next time, stay informed, stay empowered, and stay well.